How does gut health impact sexual function?
All right, let's do this.
Do it.
So I might need your help on some things here, Rena, because you're the expert on sexual function. And let's start with this. There are risk factors for erectile dysfunction, hypertension, hyperlipidemia, diabetes. Every single one of those things, there's clear-cut evidence that gut health plays a role. Clear-cut evidence. And by the way, fiber has been shown to address in randomized controlled trials blood pressure and lipids and blood sugar control. So that is one of the opportunities that we have, is that the gut is connected to our metabolism. Hypertension, hyperlipidemia, and diabetes or lack of blood sugar control are all indicative of a metabolism that's out of balance. It needs to be healed. When we heal our gut, one of the benefits that we receive is improved metabolic health. Number two, one of the things that's quite strongly connected to erectile dysfunction is inflammation. And inflammation can affect blood flow. That's interesting because the gut is clearly connected to inflammation. 70% of the immune system is actually resident in the gut. And when that immune system that's resident in the gut gets activated, it releases cytokines. Those cytokines activate inflammation throughout the entire body. And there's pretty clear evidence that inflammation is connected to erectile dysfunction. Out of curiosity, since the pandemic started, have you noticed an increase in erectile dysfunction?
I have, yes, but the reason being is people are sitting more. They're getting high tone pelvic floor, which is then affecting blood flow to the penis. So that's one of the big reasons I've been seeing after COVID, because now people are working from home. Before they were at least walking to the car and walking around their office, and now they're just sitting at home.
Got to get up and move around.
Yeah, so that was one. But yes, I mean, certainly people who had COVID, who got inflammation, also had
like long COVID.
Yeah, had erectile dysfunction afterwards.
Exactly. It's one of the manifestations that can occur. And they too typically will also manifest gut symptoms at the same time.
Yeah.
So showing the connections in real time that exist between these things. There are some people where anxiety and stress play a role in erectile function. And it goes back to what you and I were discussing earlier with the autonomic nervous system, this balance that exists between sympathetic and parasympathetic. And in order to activate blood flow to the genitals, we need to activate the parasympathetic nervous system. So
remember point and shoot in med school.
Exactly.
Parasympathetic to get the erection.
Oh man, you're kicking me back to 2003 right now.
Sympathetic to have the ejaculation. Yeah.
Sympathetic for the ejaculation. And anxiety in general, right? Where, as we discussed earlier, through the brain-gut connection, there are ways in which the gut does play a role in affecting our mood. I am not, by the way, claiming that this is the only thing, right? There's other aspects.
Sure.
But I do believe that this is part of the story of how we can actually improve our health and address those issues.
Yeah.
Right. So we've talked about metabolism and metabolic risk factors. We've talked about inflammation, and we've talked about from a psychological perspective. Now let's focus on the gut microbes themselves. Of course, testosterone plays a role in the ability to get a vigorous erection. In women, there's specific microbes associated with female sex hormones. And we actually have a word for it, which is the estrobolome. I'm not aware that there's been a word for men's microbiome, whatever, we could come up with something for that.
Sure.
But there are microbes that have been found to be associated with the production and activation of testosterone. Specifically, there's one called Clostridium scindens that's been associated. And if we take a look, like if you took a group of 100 men who have erectile dysfunction and you ask the question, what's happening in their gut, right? What's up with their gut microbiome? If we tested them, we would discover that on average, those men have less gut diversity compared to healthy men that do not have erectile dysfunction issues. There do seem to be these opportunities. I don't want to sit here and make the claim or make it seem like this is a direct the microbes and erections, right? But like, I think that the way that in general the body works is that like we can elevate our health. And when we elevate our health, we're rising the tide on many different aspects. And that can include sexual health, sexual function.
And potentially hormonal health, you would say too. Do you think there's
definitely.
Yeah.
I've been thinking about this. So one of the topics that I think a lot of men want to know is, what do I take to elevate my testosterone levels?
Yeah.
So, and I've seen, you tell me what supplements you would recommend, but like what I've seen is recommendations are things like, for example, zinc. Okay, that's interesting. Zinc definitely repairs the gut barrier.
Zinc has a lot of actions on the body, right? Multiple actions.
Yes.
Yeah.
So again, like these things, it's hard to prove that it's exactly this.
Yeah.
But when you repair, I know for a fact that zinc repairs and restores the gut barrier. When I was at Northwestern for my internal medicine residency, we would treat people admitted to the hospital with hepatic encephalopathy. We would treat them with two things, zinc and antibiotics. And I didn't realize until many years later when I started really studying the gut microbiome, both of those things that we were doing were actually helping to repair and restore a healthier gut microbiome, which was preventing them from having this hepatic encephalopathy. So like that condition is a gut mediated thing. So zinc is an example of one. Heard people talk about antioxidants like quercetin. Quercetin is also clearly beneficial to the gut and gut microbiome. It's a polyphenol and it's prebiotic. So what
I would say that the data is not super strong, but if you're talking about minerals, it would be like zinc, magnesium, and boron.
Yep.
If you're talking about other supplements, there are some like Tankat Ali and there are a handful. The data's not like super strong.
Yeah. And Tankat Ali, I don't know enough about to say what the effects are on the gut microbiome. I haven't seen a study on that.
But I would say that none of the supplements have robust data and it's very individualized. Like if you have a deficiency in zinc, magnesium, or boron, yes, I think it would be helpful. If you don't, then probably not.
Testing can be really helpful, I would imagine, right?
Yeah.
Because if a person were wanting to approach using that strategy, ultimately what helps is like, how do you feel and what's happening with your testosterone levels?
Right. Yeah. Exactly. So a couple other questions about gut health that are sort of related. We talked about alcohol a little bit in terms of red wine. How does alcohol, marijuana, other drugs, any yeses and nos in terms of those categories?
Yeah, I'm like gonna ruin everyone's fun, so please, I apologize. Okay. The truth is that the data that I've seen has me worried that alcohol is causing harm to the microbiome. With total clarity, if you drink to the point of having a hangover, you have caused harm and damage to your gut microbiome. The spot where it gets quite much more debatable is when we talk about something in the spectrum of 1 to 2 drinks and, potentially not causing any sort of effects on the following day, no hangover effects seen. It's less clear what happens there. But there was an interesting study that sort of changed my perspective on this, and I just came across it in the last few years. And I really tapered back my alcohol consumption after seeing this. So they took a group of people and they had them drink, it was vodka, and it was a significant amount. What they did is then they tracked the blood alcohol level and their blood lipopolysaccharide level. Lipopolysaccharide is something that is leaked into the bloodstream when our gut barrier is damaged and broken. So you find it in your gut, like in your gut microbiome. It's not supposed to be crossing into your bloodstream except when there's damage or injury to the gut microbiome. And what they showed was that basically these were parallel graphs. You could weigh them over the top of one another. When the alcohol level spiked, so did the lipopolysaccharide level. When the alcohol level came down, so did the lipopolysaccharide level. The lipopolysaccharide level did not normalize until the alcohol level normalized.
Fascinating.
So from my perspective, based upon that, that doesn't answer the question, is one drink harmful? Like, that's not exactly the same question.
Right.
Right. But the fact that the alcohol level on all levels in all amounts was concurrently associated with an increase in the lipopolysaccharide, and acknowledging just the real world, where if I have a drink and it's only one drink at 2 p.m, I'm going to feel tired in a couple of hours.
Yeah.
Right. It leads me to believe that that alcohol is causing harm and injury.
Yeah. Well, I mean, there's also so much data now that no alcohol is good in terms of cancer prevention.
100%.
So I've stopped myself too.
And REM sleep is clearly disturbed by even one drink.
Right.
So exactly. there's other aspects as well. Marijuana has emerged with, like, as alcohol seems to be becoming less popular, marijuana has become much more popular. I have serious concerns about this. Now, part of it is the cognitive effects. We used to call them like a pothead. That's real.
Right.
They've actually studied this and looked at brain size and shown that the brain shrinks with chronic marijuana use. But in my space as a gastroenterologist, there's something that happens called cannabinoid hyperemesis syndrome. Let me paint a picture for you. A patient, typically a younger patient, comes into my office, says, I've been like throwing up around the clock. What's going on? And I ask one question. Do you love taking hot showers? They're, yeah, I feel so much better. I could take them for like an hour straight. That person Like ultimately, I have to work to like get the question directly answered.
Yeah.
Sometimes the parents are in the room,
Yeah.
but that person, that's cannabinoid hyperemesis syndrome. The chronic use of marijuana can ultimately lead to the development of chronic nausea and vomiting,
Wow.
sometimes called cyclic vomiting syndrome.
Yeah.
And the problem is that they feel better when they smoke. So getting them to quit can be quite challenging. And you have to educate, but sometimes you also have to give medication for support.
I never learned about that. That's fascinating.
Yeah, it used to be a rare thing. It
Mhm.
used to be like you would sound, in residency super smart if you brought up this concept.
Yeah.
Now it's out there all the time.
Wow. That's so interesting. I want to touch on toileting habits. Sitting on the toilet for too long, what harm does that cause?
I think that my main concern is the effect that it has on the pelvic floor and specifically hemorrhoids. So hemorrhoids are these 3 beds of venous tissue that carry blood. Think of them like an airbag for a car.
Mm-hmm.
They're there to protect us. And most of the time they're not filled up with blood. But when you sit down on the toilet and you're about to poop, they fill up with blood. The more time that you spend, the more time that those tissues are filled with blood, and it can be harder to get the blood out of them afterwards.
Mm-hmm.
And this can make people prone to developing hemorrhoids.
Mm-hmm.
So hemorrhoids by the age of 50, about 50% of people have these issues.
Wow.
They
50%.
Yes.
I did not know it was that high.
And they wish they did not.
Yeah.
And one of the reasons that this happens, like people classically think of it as being purely constipation. Yes, bearing down does promote flares of the hemorrhoids.
Mm-hmm.
Also, any change in bowel habits, not just constipation, but also diarrhea can make them more likely to happen. But the fact that you sit on the toilet for too long is problematic. So what I've always advised people is 5 minutes.
Mm-hmm.
So like, don't force it. Don't push super hard to get it out.
Yeah.
But don't sit with your phone. I think this is kind of a guy thing.
No, I think it's an everyone
It's
thing.
an everyone thing. Okay.
We like hide from our kids in the bathroom.
Yeah, it's like a quiet place.
Yeah.
Yeah. Kind of nice to have a minute.
Although my kids will still walk in, I'm like,
Yeah. Mine too. Sometimes our nanny as well.
Yeah.
But yeah, no, you want to keep it ideally 5 minutes, but like certainly less than 10 minutes.
Yeah. What about using a bidet versus using toilet paper?
I'm 100% team bidet.
Oh, me too. I love bidet.
Oh, I think it's one of the best things that you can spend your money on, honestly. Like if you want to...
It's not even that expensive.
No, it's not.
You get on Amazon for like, I forget, it's so inexpensive.
Yeah.
Yeah.
Oh, it's the best. And it's also, by the way, a great way to clean the bottom. So one of the issues that exists is many people use wipes.
Mm-hmm.
I would caution you against that because the body has a natural moisture content and also natural sort of oils that are a part of that part of the body. And when we use wipes, we dry them out. And that's actually the #1 cause of what we call pruritus ani,
Yep.
which is anal itching.
So that's, very similar in women in the vulva, which they'll use wipes or they'll overwash. And I'm sure it's similarly in the rectum or the anus, where you'll overwash and you develop itching.
Yeah.
And you develop discomfort and dryness. And for women, oftentimes they'll come in with symptoms like, oh, I think I have a UTI.
Yeah.
But it's really a lot of overwashing and over cleaning the area that naturally doesn't need that much aggressive cleaning.
Sometimes the hemorrhoids need to be treated when people have anal itching. A very large percentage of people, if you quite simply tell them to take a break from washing their bottom, stop using any wipes or any sort of lotions or anything that could dry out the space, and then reduce the temperature of your shower, it will get better. And washing with water is still perfectly hygienic.
I want to end with talking about anal sex. So certainly anal sex has become more commonplace, I think, more accepted in both heterosexual and homosexual relationships. What are tips as a gastroenterologist you would say, knowing like the health of the tissues, the safety of doing that without injury? What are tips you would have for the average person?
So I think that this thing is something that should be entered into with a partner that you feel safe and comfortable and you communicate with. I think it's really important to like have that ability to communicate.
Yeah.
So that you don't rush and you can ease into it. So, and when I say ease, I don't actually even mean like jumping straight into anal sex. I mean like working through what could be a period of time where it's foreplay, right? Or using toys and starting small and then working a little bit larger over the course of time to get that part of the body used to it. It turns out that these tissues in the bottom, basically like there's 2 things that you'll find there: muscle tissue and skin. And they both kind of need to be adapted before moving forward with doing anal sex.
Yeah.
So by introducing first smaller things and slowly progressing, it gets the area adjusted to it. It allows you to see how it feels, see whether or not this is something that works for you.
Mm-hmm.
And in a way, like in the same way that we develop a callus on our feet by walking on our feet,
Mm-hmm.
right? It sort of helps that skin to get a little bit tougher prior to moving forward with anything. So now, once you sort of move beyond that, then I think it's important for people to do this in a way where it's pleasurable, it's comfortable.
Mm-hmm.
You can stop it if you want to, using a lot of lube, going slow, and when on the receptive side, breathing.
Yeah.
So like I think like those are the basic tips. Afterwards, again, like I don't think that using wipes is advisable. Using a bidet absolutely is fair game. And then if you have bleeding, fiber supplements can help with anal bleeding. The source of bleeding within that context, the expectation is that it's traumatic. It could be the hemorrhoids that have been traumatized.
Mm-hmm.
It could be internal tissues, or it could be the development of an anal fissure. Many times, resting the bottom, increasing fiber intake, possibly adding a stool softener will allow you to like have soft, comfortable bowel movements. And you do this for about 5 days, just give the bottom a break to allow those tissues to heal.
Do you have a preferred stool softener?
There's options. So like you want the basics, you could do Colace. Colace is something that's not going to give people like you don't want diarrhea
Yeah.
in this context,
Yeah.
right? So you just want something that's going to kind of just keep it soft. So Colace can definitely get the job done. Now, if you have experience using magnesium, I'm a huge fan of magnesium, specifically magnesium oxide,
Mm-hmm.
citrate,
Mm-hmm.
or sulfate. Glycinate and threonate are not for pooping. Those are for sleep or other magnesium needs. But citrate, sulfate, oxide, those three, if you have experience with them, I think they're wonderful stool softeners.
If you guys enjoyed this clip with Dr. Will Bulsiewicz, make sure to check out the full episode right here.